You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
The FrameworkLTC Innovation Conference was September 15th through the 17th, 2025 in San Diego. We're bringing you press coverage from the floor where long-term care pharmacy connects and innovates. Today's episode spotlight real-world tech that's reshaping LTC operations from analytics to access and how those tools translate into safer, faster care. FrameworkLTC from SoftWriters powers hundreds of LTC pharmacies with workflow automation, billing, and real-time insight across dispensing and delivery. If you're building a resilient, scalable LTC operation, this is where you'll see what's next. Across this series, we sat down with leaders in LTC pharmacy, operators, clinicians, and partners to unpack what's working, what isn't, and which integrations are worth your time. This coverage is sponsored by the FrameworkFocus podcast, part of the Pharmacy Podcast Network, your monthly deep dive into trends in tech shaping LTC. Stick with us for candid conversations, practical takeaways, and a front row view of the conference.
FrameworkFocus, the podcast for everything long-term care pharmacy.
Hello, this is Daniel Fuller. I'm the Director of Customer Service with SoftWriters, and you're listening to FrameworkFocus.
Hey, Daniel, it's great to be here at the Innovation Conference 2025. Thanks for letting me be a part of this. This has just been wonderful.
Yeah, it's been awesome. Collaborating with customers. A lot of times, from a sports standpoint, we often get to hear them on the phone, but we never get to see them face-to-face, so this is great, putting a name to a face.
Absolutely. I remember when I was with the SoftWriters team, a tiny team back 2004 through 2008, and we would do the demos, we would take them through the sales process, contracting, implementation, training, then implementation. And we were a smaller team, so it was harder to kind of like really assess what's the next stages. Well, we jump ahead a year later. The importance of customer support and dialing into each of the product's strengths, which mirror the strength of the pharmacy, that's where the sweet sauce is. So talk to us about how you manage that as a customer support director. How do you talk with or foster relationships with your clients so that they can get the most out of FrameworkLTC?
Yeah, absolutely. So often customers will call in. Of course, they are typically either having a question or an issue, something along those lines. But we try to take it one step further than just answering their question or their inquiry, trying to make sure that we completely understand how they're utilizing the product, give them any type of tips that they may use just to help them out along their process. So. But yeah, and then of course we resolve their issues and always striving to go ahead and have a world-class service here.
So one of the best facets and parts of being in customer support is anticipating what an issue might be based on something that the client is explicitly focused on, but then it opens up other things that may be taking place. Talk to us about how you foresee things that the customer might be experiencing so you can get ahead of it.
Yeah, absolutely. We in customer support, we have a very wide knowledge base that we built over years and years from a historical standpoint. Mm-hmm. And that allows us to go ahead and quickly key in on certain things that are occurring to go ahead and get us to the source of whatever that issue is. So our objective is to go ahead and resolve that issue first time that it is called in. And utilizing tickets and the knowledge base that we've had from a historical standpoint really helps us out from that stance.
So in being customer support director, you get a lot of different people that are working with you who have relationships with different pharmacies, and those relationships super important because then you really know them personally rather than cookie cutter. It's very customized in the way that you're kind of managing the clients. In doing that, what do you get most excited about in working at SoftWriters? What part of customer support do you like the most?
Well, for me, it's a passion about helping people, you know. I've been in support for a very long time, and to go ahead and bring in new folks, new blood into here, and then see them go ahead and establish relationships with customers to a point where customers are, sending surveys back and they're referring by name to those individuals. It really shows the progress that we've made as far as connecting in with our customers and letting them know that this just isn't a number, it just isn't a ticket. We're here to help them.
Daniel, thank you so much for this time here at the Innovation Conference 2025. We're excited about being here, and we're very excited about the future of long-term care pharmacy.
Absolutely. Thank you so much.
Hey, we'll be right back with more Framework Focus. Chad Wers here at the FrameworkLTC Innovation Conference. Chad, this is good to see you.
Good to see you.
Fellow podcaster has been added to your long list of things that you've been doing over the years.
Yes, we during COVID we got some extra space. We did what everybody did, the other thing. Everybody got rid of their space. Mm-hmm. We actually acquired some more space and put in a proper conference room for our meetings, and then also took the other side of this space that we have and turned it into a studio.
That's awesome.
So part of that was, during COVID, we did so many webinars, and you're doing them from your office on your laptop computer, and we decided that was going to be a theme coming out of COVID, so we might as well have a professional location to deliver some content, and then out of that came the idea of the Our Experience podcast. So
excellent. Tom does a really good job with you. He's a fellow Pittsburgher originally.
Yeah.
We lost him to North Carolina.
Yeah, that's right.
But being here at a conference that's all about long-term care, it's the backyard of what you've been doing since before even ASCP, when you were in consulting. Talk to me about what's important right now, what ASCP is helping its members with. Where's the concentration at?
I think the biggest thing for whether you're a pharmacist in the long-term care space or the older adult space or a pharmacy, it's how are we going to generate enough sustainable revenue? Mm-hmm. Like, how are we going to succeed and survive as practitioners, and how are we going to survive as pharmacies? So we're obviously spending a lot of time on the Inflation Reduction Act and what is going to happen January 1st of 2026. It represents a significant threat to pharmacy. We think there's some ability to work how it's being implemented, that long-term care pharmacies can get some benefits, some sustainability. Time will tell. We got 3 months to put this in place. It's a challenge. I'm old enough to remember 2006 when we implemented Medicare Part D and how crushing that was from January until probably middle of April. The government doesn't do these things well.
Yeah.
And I think the concern is, why would they be all of a sudden good at it now? And you're talking about paying pharmacies for the medications in a completely different way that is generally slower, so 3 weeks slower, and generally a lot less. So how are they going to be able to run their business, especially if we have to figure out this implementation and get it working smoothly? So there's multiple factors. We try to be positive. We try to stay positive that the industry as a whole will come together and help these things work out. The PSAOs, the wholesalers, the manufacturers, becoming more of a partner in helping a pharmacy bridge this. So we're working on that. And then on the pharmacist side, all of the things that they can bill, incident to physicians, some of the codes that they're allowed to bill. We're trying to make sure that those pathways stay open. Some of them open during COVID and remain open, especially as it relates to telehealth. So we're trying to make sure those stay open, and then further making sure pharmacists see them and start doing them so that we can say, hey, we're using these, don't get rid of them. Pharmacists are using them to help patients have better care.
Mm-hmm. What I've noticed when I started in pharmacy 2004 with SoftWriters, first conference I ever went to was ASCP. All pharmacies, right? All entities, pharmacists running around that were part of pharmacies. Your organization is now attracting the standalone consultant, realizing all of the information that you're doing that is so prevalent and needed for our long-term care pharmacies or skilled nursing pharmacies. Now the individual is like, holy cow, there's so much information, there's networking here, the people teaching me how to grow my individual consultant business. I think that's exciting.
Yeah, it's really exciting. We're fortunate we got a grant from the John A. Hartford Foundation for their age-friendly movement, which really is more of a linguistic and a language that people use when it comes to taking care of older adults in the medically complex. We think it's super important. We've started a program where a pharmacist can become an age-friendly champion. I don't want to say it's easy, but it's a low bar because honestly, a lot of our members are age-friendly pharmacists. But we want them to talk in the same language as the clinics and the hospitals and the physicians' offices out there that are age-friendly as well, so that there's this common understanding. So we're doing that. We're also going to extend that to pharmacies. We're going to develop an age-friendly pharmacy credential that we think will not only help people understand that this is, the public will see this as you're an age-friendly entity there to help me, but also be able to speak to PBM networks, be able to speak to clinically integrated networks that work with insurers through CPESN, that these pharmacies know how to take care of older adults in the medically complex, because in the future there'll be many more of them in assisted living and at home than in nursing homes. The nursing home is a flat 1.7 million beds. So we're pushing people that are more ill or have more comorbidities out into the community settings, and we have to have pharmacies and pharmacists that are prepared to take care of them. And then ultimately, as we get back to the front of this conversation, we have to have the sustainable reimbursement to be able to do those things. So a lot of what we're doing is really around that concept and trying to elevate what our members feel like in their practice settings, elevate them to the communities, elevate them to the PBMs, elevate them to the insurers and the payers.
The ASCP Super Bowl of the year is coming up.
Yeah.
Give us a little preview.
It's actually here in San Diego. It'll be October 23rd through 26th. There'll be a lot of what we just talked about, as well as a lot of our board-certified geriatric pharmacy credentialed education. And really, ultimately, it's the networking, I think, that makes our association so unique. We're smaller. You can walk up to anybody and ask them what they're doing in their part of the country. Our members generally share. They're not worried about you stealing their ideas or their business because they're working in different parts of the country. And it makes it a really valuable experience for people. And they learn a lot, and they can go back to their practices and implement a lot of what they see at our meetings. So we're excited about that.
Force is strong with you.
That's right.
Well, I enjoy talking with you, Chad. I hope to get you on an upcoming program. Maybe after the conference, we'll get you on This Week in Pharmacy and really feature a couple outstanding consultant pharmacists. I even think of pediatrics. I got Jenna Quinn out there just rocking the world, and she's a consultant. Yeah. She's a consultant pharmacist. And
I remember talking to her. She was about to walk into her first pediatric facility, and I think she was in the car. And she's like, is this what I should be doing? And I'm like, absolutely. Like, a pediatric long-term care facility is obviously different in the sense of the clientele that they serve, but ultimately it still requires the expertise of a pharmacist. There's still medications there that have to be, handled correctly, and there's still very delicate, vulnerable people there that need the assistance of a pharmacist. We live at this beautiful intersection of high medication use and medically complex and older patients, and healthcare can't survive without pharmacists. I'm not an apologist for pharmacists and pharmacies, and I'm not somebody that thinks we have to go out and tell you how valuable we are. Like, you're going to come to us because you need us.
Exactly.
So how do we make that work a little bit better from the perspective of pharmacy? So,
Chad, thanks for spending time with us here at the FrameworkLTC Innovation Conference. Appreciate
Happy to be here. Yeah, thanks, Todd.
Thank you.
Hey, this is Adam Brown. I'm with Eros, and you're listening to FrameworkFocus.
Hey there. I just saw your booth, Eros. You're here at the FrameworkFocus Innovation Conference. Tell us about what you do in the space of long-term care pharmacy.
We are all about providing IT support and services to long-term care companies, purpose-built for long-term care companies.
Okay, so I came from the infrastructure world and telecom, where we would outsource people's servers and firewall management, and so is that kind of something that you're doing, that you're taking over IT infrastructure?
I'm glad that you brought that up. An important thing that we like to speak on is how, we could take over the burden, take the burden off of your internal IT, or we could be an extension of their services.
Okay.
I mean, if you're looking for some specific expertise and a specific need, we could take that on. We could take that as a project. We could be an extension of their services, not necessarily complete replacement, but servicing whatever their needs may be.
Yeah, because if I'm a medium, small size long-term care pharmacy, I might not want to hire a full-time IT director. I might want to outsource some of my protocols, or at least have you help me build that and then manage it some way.
That's right. One of the other things we hear a lot is the challenges of having CapEx cost of replacing servers, replacing people, and an OpEx cost with a service provider like us has you a standard bill that is predictable.
Adam, are you turning long-term care pharmacies infrastructure into what we would consider the cloud?
It depends on the scenario. There could be a situation where that made sense if your company was rapidly scaling. Mm-hmm. There's a hybrid aspect of that where it could go mostly to the cloud, and then some of your data and services could exist in our private cloud. Mm-hmm. It's really all about the customer's profile, what their needs are, and what those solutions may be. We're flexible.
All right. So how do you assess the need? Meaning, a pharmacy operator reaches out to you and says, "Hey, what's the top 3 issues that a long-term care pharmacy is experiencing that Aeros would solve?"
I think the core product of everything that is offered these days starts with cybersecurity.
Okay.
And then beyond that, we're talking about all the ways we can make systems secure, reliable, and scalable.
All right, listeners, you're listening to Framework Focus. When we come back, we are going to dig deeper into cybersecurity and the impact on your long-term care pharmacy business. Adam, thanks for being part of the show.
Thanks for having me, man. This is amazing.
In long-term care pharmacy, decisions can't wait, but disconnecting systems and static reports can slow you down. SoftWriters is introducing a new way to manage your data with Framework Insight. Framework Insight is an AI-powered business intelligence platform built for LTC pharmacies using FrameworkLTC to manage day-to-day pharmacy operations. With intuitive dashboards, you can track key metrics like prescriptions filled, drug costs, inventory trends, claims, and profitability. Drill down, set alerts, and save custom views so you're always a step ahead with at-a-glance and on-demand visualizations into your pharmacy's most essential metrics. Framework Insight syncs your data daily, giving you instant visibility into both daily operations and comparing current trends to historic performance benchmarks. Turn data into decisions, and decisions into progress. To see it in action today, visit frameworkltc.com/Framework Insight.
Lifespan Pharmacy. Dakin, where is Lifespan Pharmacy out of?
We are located just north of Indianapolis.
Okay. All right. So one of the parts of technology, I was talking to you before we started the interview. I used to outsource back in my telecom days, where it was a big deal to take infrastructure out of a organization and then put it into a data center. And part of that service was firewall protection, and protecting. And back then, protection wasn't even a big deal, right? It was freaking 2002 or 2003. Now there are businesses, multi-billion-dollar businesses, that are doing nothing but trying to find ways to weasel into your system, get the PHI, and then hold you hostage. You had a session here at the Framework Innovation Conference. Share that with our listeners.
Yeah, no, just exactly as you mentioned. It is a multi-billion-dollar enterprise. there are people out there that are working just as hard to compromise your data as you are to protect it.
Right.
So it's a constant battle of making sure, especially in today's environment where you have, the buzzword AI and you have all these different applications and tools that are making it a lot easier for people to figure out how to compromise networks and databases. To make sure that you're also, on the flip side, learning what they're learning and then turning around and combating it as well. So just to tie it into kind of, the morning conversation with Dr. David, trust is a big thing. So trusting your vendors and leveraging your relationships with vendors, and especially, networking at conferences like this is huge for protecting, patient information and learning what other customers are doing.
So talk to me about your pharmacy. So back in my day, I can say that like 20 years ago, I'm getting old, but back in the day when I started in pharmacy, we had mostly long-term care pharmacies, but then all of a sudden I started seeing skilled nursing coming in, and then we jettisoned to the modern day. We have home infusion, and we have long-term care pharmacy at home, and remote patient monitoring, and long-term care pharmacy is much different today, and therefore there's more ways for the criminals and the not so upstanding organizations to try to break into your network. Talk to us about how innovation, as much as wonderful it is, it's also a danger to our long-term care pharmacies.
Yeah, I think with any niche industry like we have here in long-term care pharmacy, it becomes an increased vulnerability because, like I said, like on the networking aspect, you don't have as many people combating the issue, where you may have the same amount of bad actors who are trying to compromise, or gather that patient data or billing data or whatever it might be. So we really have to rely on who we would consider competitors in addition to our vendors to make sure that we protect ourselves as an industry overall.
Do you have a vendor type that you're working with that assures your network security and your password compliancy, and maybe a protocol to follow, to your employees to follow? Like, what are you doing to make sure that you're trying to keep yourself safe? Yeah,
so in full disclosure, we use ECW, RX Cloud as our vendor for IT solutions, and we take the approach of it's easier to block everything and then request access, like almost to the point of being annoying. So I'm sure a lot of times, our employees think it's annoying that we have this website blocked or whatever. But and I kind of alluded to it in our talk today, especially in the day of remote work. We do have work laptops available to associates who are working at home, and they may or may not be using those as personal devices while they're at home. So while a lot of stuff comes with good intention, we can't be there to monitor everything all the time. So we rely on that trust with our partners.
So we are at the FrameworkLTC Innovation Conference. Why do you take your time? I can imagine how busy you guys are at Lifespan Pharmacy. Why do you take the time and money and investment to come to this conference?
I think it's exactly that. It's an investment. It's not only maintaining the relationships you already have, but also learning what new players are out there, what new up-and-coming sharp minds are available, and going to these panels and, like I said, just figuring out what other pharmacies are doing as well, because it is a time, not just from like a legislation standpoint, but as we're talking about cybersecurity, we're all kind of in this together in a way. So it's sort of when you're not attending these events, you're falling behind.
I love it. Dakin, I want to just thank you for being part of the FrameworkFocus podcast covering FrameworkLTC Innovation Conference 2025. Thank you.
Thanks, Todd.
An aspect of long-term care pharmacy and the importance of fulfilling an ecosystem is the delivery of services. There is an expert here that is a platinum sponsor of the FrameworkLTC Innovation Conference 2025, Donnie Satcharov of RX4Route and pharma staff. I've worked with your organization before. I love your energy. Donnie, welcome to the show.
Thank you so much, Todd.
All right, why do you invest the time and the money to come to the FrameworkLTC Innovation Conference?
Because with the pharmacies, imagine if you were to do everything correctly from top to bottom. Filling the prescription, everything on time, contacting the patients, and you do something wrong at the delivery part. Everything that you've done previously will not matter to the patient because now the delivery is messed up. that's why we've invested so much to come in here and to show all the pharmacies the mistake that nearly 80% of them make is by ignoring the delivery software that they're currently using.
And Donnie, they're not concentrating on that because they're the clinical specialists. They're the ones that are dialing in to disease states that are hampering the lives of our seniors, of people that are in group homes. So we have to rely on organizations who understand logistics and understand how to connect that logistics with a pharmacy management system. Talk to us about how RX for Route works specifically with long-term care pharmacies.
Absolutely. Number one difference between us and any other delivery software that long-term care pharmacies might be using is that we are originally built for long-term care pharmacies, right? Starting with the batching of orders for long-term care, ending in with informing by the email or text message to the nurses about the upcoming deliveries and about the timing that they will be receiving the prescriptions as well. And a bunch of additional features that are solely built for long-term care pharmacies.
I've heard about your expansion from Alexander. He's an amazing team member of your team. I like hanging out with you guys. He's told me about expansion into Orlando, into Ohio. Talk to us about how your organization's on fire right now and how you're expanding in long-term care pharmacy.
One of the most biggest courier companies, RX2Go, that currently does 20,000 deliveries on a daily basis, have expanded quite significantly using our softwares. And most of our courier companies that use our softwares, they've opened up multiple different states by the power of our software, by how simplified everything is.
All right, so when I think of the importance of that last mile, getting the product to the patient, I understand the facilities, I understand skilled nursing centers or group homes, and that makes a lot of sense. Some of the future of long-term care pharmacy is going to be delivery to the home. And what's interesting about your organization, because Pharmacy Podcast Network and RX for Route has worked together before, is the community space where you're able to take long-term care pharmacy services to the home. Talk to us a little bit about expansion of long-term care pharmacies into the home.
So delivering to a nursing home facility, to a nursing facility and to a home facility, it's two different types of deliveries that should be taken a completely different approach, right? Obviously with a nursing deliveries, I shall call, it should be batched and it should be organized completely a different way us compared to a regular home deliveries, right? With the home deliveries, it's you're delivering it to the patient. You must inform them about the upcoming ETA. You have to text and you have to call them in advance. And the driver has to be informed that it's not as simple as walking into a facility. It's someone's house that you're at the end of the day coming into.
Yeah, there's a lot more personalization to it. There's a lot more trust involved in it. And an organization that understands protocols and understands that sensitivity, the professionalism that you bring to it, that's important because that's the name of the long-term care pharmacy in the community. I mean, that's their reputation.
Absolutely, absolutely.
All right, so we're excited that you guys are here at the FrameworkLTC Innovation Conference 2025. Give a shout out, tell our listeners how to get a hold of you, how to get involved with you so that they can get started.
Actually, you can log into our website and there is a button of booking a demo with me directly for the next 24 to 48 hours. And you're able to book a demo with me directly, book a quick call, and I can explain you, I can run it through what exactly the changes in your pharmacy will be just by quickly switching to RX for Route. At the end of the day, you're not married to the current software that you're using. You don't have to stick with it.
Yeah, you don't have long-term contracts or anything.
You don't have long-term care. It's with us, it's months to months. With us, we're as good as the contract gets.
Yeah, all of the clients that are hooking up with you are staying with you. You're growing a reputation of excellence and customization, and the protocol between one pharmacy and another might be a little different. You guys are willing to do that.
Absolutely.
All right. So tell us, what website should we go to learn more about you guys?
rxforroute.com.
Please go to rxforroute.com and ask for any of the team members. Ask for Donnie. Get a demo. Let us know what you think. Thanks for being here.
Thank you, Todd.